And here we go. Good Performance Podcast, Otto Zaccardo, Troy Shallow. Today we're joined with the strongest PT in America, Brett Raynor. We don't know if he's actually the strongest, but until proven otherwise, he is the strongest physical therapist in America. Troy, you can do the intro since you and Brett have a bit of a history and know each other pretty well, so take it from here.
Yes, Brett was a former teammate of mine at Merrimack. He was a linebacker from the DMV in the N.
Shout out DMV.
And on the note of the strongest PT in America, I would have to agree with that until we find someone else. He is always, when we were at Merrimack, Brett was he's in the weight room. Everyone's watching Brett. He was a stud and just a great guy to have as a teammate, a great guy to now past college in the PT world, talk to about different things and bounce different things off of him. I believe right now he is, did you just pass your board? You passed your boards, correct?
Yeah, I took boards, I don't remember, last week of April, and I've been working for almost a month at a sports clinic.
Great.
Yeah.
So that's now, Brett, introduce yourself. Tell us about yourself. Tell us about yourself. What?
We haven't figured out the introductions yet. I do a little intro. I say I'm not good at intros. Troy does a little intro, and then we go, okay, Jess, now you introduce yourself.
Yeah, tell us about yourself. Where you grew up, how you got into, football, how that became your sport. I know there was some wrestling that you did as well.
Yeah.
And, give us the Brett Raynor lore.
Yeah, we'll go 3 minutes, condensed summary, and then we'll get into the nitty-gritty. We'll try that.
All right. No promises it'll be at or under 3 minutes, but I'll do my best.
It's all right.
I'm not timing.
So, started playing football when I was, I think, 5. I did a year of soccer when I was 4 for God knows whatever reason. Hated it, obviously, then got into football. Grew up until high school. Football and lacrosse were kind of the main two. Wrestled for probably 6 or 7 years. And then everything kind of phased out, and then football just kind of became the main priority throughout high school. Played all 4 years. Actually, that's not true. Freshman year of my high school career, tore my ACL. Literally doing field workouts in the summer going into my freshman year with the team, which really sucked. So I had to sit out freshman year, which is how I got introduced to PT. Had an excellent PT. The guy's name is Brian. I credit him a huge reason to where I'm at today. Because you see people that go to PT and they just go through the motions and hate it. But he was the man. He did a sports residency through Delaware, so he catered everything to me. And I'll never forget the last day of PT it was me, him, and one of the techs at the time who I still keep in touch with. We did pickup football in the parking lot for an hour and a half. And that was my final day of PT, which was dope. So yeah, that was kind of where the interest for PT sparked. So out of high school, wasn't the highest recruited guy football wise. Coach Curran and Coach G kind of took a chance on me for Merrimack, and I ran with it, which is where I met Troy. We had, I think, pretty similar personalities, and became pretty good friends there. Played all 4 years there, graduated in 22, had about a week off, and then went straight into PT school. I got accepted April of my senior year to University of Maryland, Baltimore, not College Park, which a lot of people think are the same thing, a little different. Baltimore's grad schools. Got into there, started mid-May or end of May of June 2022. Went through school, got a ton of great connections, learned more than I could have ever even imagined in 2.5-3 years. And now I got a job at a sports clinic called True Sports, and it's best job in the world. Loving every day. So
thank you.
Yeah. Oh yeah.
Yeah. So you touched on that, the ACL kind of leading you into your PT route. Were there any other injuries that you had, after that first ACL and then maybe the rest of high school and college? Any other injuries that you had that, helped you learn more about PT as well? Maybe you got injured and you were I'm going to research and find, the best way to do, rehab for this, whatever it is. And then that helped you in your PT route as well. Was there anything like that? Or
I have had, every injury in the book probably. ACL was the one that really got it started. Senior year, of high school, had a partial ACL. It was like 7% torn, and then a meniscus tear. So I had to have a second surgery for that. Didn't actually end up doing PT for it. The surgeon, it was the same surgeon who did my first surgery. He was kind of like, yeah, man, like I feel like you know what you're doing strength and conditioning wise. So like, he's like, just stay off of it for like a week, because I was supposed to be technically non-weight bearing at the time. And he's like, and then you can load it up, and it's kind of just activity as tolerated at that point. So I kind of had the green light after a week to just keep doing what I was doing. And it was just to hammer the legs really, which is, easy.
That's the fun stuff. That's what you like.
Yeah. And then, and we can get into that later about like my favorite parts of PT, because I have pretty strong favorite like things to treat. But then, so in college, tore both labrums in my shoulder, had a sports hernia, and I think the sports hernia was an interesting one, because that was the first time that I was really like, okay, I don't really know what to do here, because I got a cortisone injection, and the doc who gave me the cortisone injection was like, to fix this, don't do anything, rest for 6 weeks, don't do, like, just chill. And I was like, well, fuck that. I got the cortisone injection and then went to practice 4 hours later. So that was kind of when I first started getting into research. And truth be told, like, I'm not the biggest, like, I hate reading research, but I think there's some really good stuff out there. And I can't remember the article I read, but it was very just basic, like, benefits of eccentric and isometric strengthening for tendon health. So that was when I was like, all right, let me just hammer my adductors with eccentrics and isometrics. And that went well. And then Troy probably remembers Andy Cannon at Merrimack. And he had a huge role in me, one, getting into PT school, and two, just like educating me on how kind of all of PT works. And he helped me with a ton of stuff. So huge shout out to him, because without him, he made my schooling process significantly easier. So yeah, that's kind of my injury background.
Yeah. Well, it's funny that you mentioned that you learned so much from. Was he a trainer for Merrimack?
Andy was one of my professors, and probably one of Troy's too. He was the PT for like the athletic department, but he also taught a bunch of different classes. He taught like anatomy, biomechanics.
Yeah, I think I had him for biomechanics and A&P 1.
Yeah.
It's just funny you mentioned that, because I remember a lot of things that, we still implement today. I learned from either athletic trainers or physical therapists, because you spend so much time, especially during the rehab process, you spend so much time with these professionals and you're just sitting and talking. So for any athletes listening, when you go to PT or you're coming back from a surgery or an injury, pick their brains, learn what they know, because there's a lot of pieces, and I think that's really what makes that complete athlete, what makes you able to continue to train and perform for a long period of time, is not only the understanding of how your body is working, how to kind of write a return to run or rehab script for any given injury, but then also being able to smash weights and push as hard as you can. So that's why I'm kind of intrigued on your stances, because you have a pretty, I would say, unique look at this stuff. You're kind of in the professional field, with those science guidelines, because technically you have to go by like the standard accepted protocol for recovering from injuries. But there's also I'll get a cortisone shot and go to practice right away. Like, yeah, I have a broken finger or hand or something, or sprained something. Okay, well, I'm not soft. Like, I'm going to go do it. And I think that's interesting in terms of where you draw the line from a professional versus you as a former athlete, like Brett saying, nah, dude, you can hit that, or no, this is my job, I'm a professional, you need to be here and there. So I'm curious as to how you kind of look at testing and what thresholds you kind of look at. And I guess this would be a good time for you to say what your favorite kind of types of injuries or athletes you like working with, because I think that probably plays a big role into where you have to stay within the box and where you can kind of like stretch and be more creative.
Yeah, so it's tricky, because obviously I'm like a very type A personality, like just go. Like I don't, like if something hurts, whatever. But like that line kind of has to be drawn in the PT realm, because like I have a license at line, right? Like it's not like I can just be like, yeah, man, like I know it hurts, but suck it up, go do it. And then if that kid gets hurt, like it's on me. You know what I mean? Like I gave that kid the clearance to go. So like it is a lot of, I tell people all the time, like I'm a big do as I say, not as I do guy. Like I say that probably 5 times this last week, because like, I mean, again, if it was me, I'd be like, whatever, but I want these people to get better. And I know probably a lot of my problems that I've dealt with is just me being hard-headed and arrogant and wanting to go. One of the things with with rehab that I think is pretty important is I forget what you said earlier, but it's sparked this thought in my brain, and I think it's really important is I think it was when we were talking about mentors or people that have helped you out.
Yeah. Learning from athletic trainers and physical therapists, just because you spend so much time, and we can get into this, continue with your thought, but you spend so much time with them. There's also that nurturing and psychological aspect of an athlete who can't do what they do.
Yeah.
So you might as well get something from it.
I think one of the biggest things, and this is probably some personal bias coming in too, but like I saw it on Instagram one time from a PT. He's the PT and strength coach for UNC. His name's Quentin Willie or Wiley. I might be pronouncing it wrong. He puts out a lot of really good stuff, but he made a point of people put so much like thought and energy into deciding like if they have a torn ACL, like who their surgeon's going to be. But then they'll pick the first run-of-the-mill PT they see up the road. And it's like the surgeon's going to see you for an hour and a half during your surgery, and they're going to see you for 10 minutes every 8 weeks and then 2 months for, your recovery timeline. And one of the big things that I believe is pick, who you train with, who you rehab with, who you do whatever with wisely, because ultimately, like, you're going to be spending the most time with that person. And this kind of comes around to my point of like where I get a lot of my beliefs and philosophies from. I had in my last internship rotation, one of my supervisors or my clinical instructor at the time, he was the physical therapist for University of Maryland College Park, all their sports teams. And I picked his brain every single day, all day long. He is without a doubt. And if he ever hears this, dude, his ego's already so big. His ego is going to go through the roof. But I love the guy. He is, I tell people he's probably the best PT in the DMV, possibly like East Coast. Like he is so good, so smart. But back to your point of like picking their brain, like I picked his brain every single day for 12 or 13 weeks while I was there. And I seriously learned more from him than I probably did in 2 years of school, as far as like the sports performance and rehab, setting goes. And you asked about favorite thing to treat. Without a doubt, ACL, not even remotely close. ACL, meniscus kind of goes hand in hand, but ACL is a lot of fun because the acute phase, like day 1, 2 out of surgery, can't do much. I mean, they're not in weight bearing probably for at least a week, assuming there's no meniscus involvement. If there's meniscus repair, it's usually 6 weeks. They're not weight bearing, but even so, you can get really, really creative with rehab being not weight bearing. But just ACL, the fun begins when they begin weight bearing, because at that point, like, you don't really have too many restrictions. I mean, there's some you have to follow. You can really like load up the knee, and it's at that point kind of turns into 4 or 5 months of just hammering them strength conditioning wise, like just
because from my understanding, the ACL is a more aggressive rehab as opposed to other things. Like you can actually like fucking get at it in your ACL rehab, and you're supposed to. It's not like you can; it's you're supposed to.
Yeah, dude. I'm treating a kid right now, football player who had an ACL. And he's like, I think he's like 2.5 months out, and he was puking in the trash can the other day at the end of our rehab. Like we have him pay the man, and that's how it is. Like when I was down at College Park too, man, we had like ACL guys, and end of a session, we're finishing with BFR knee extensions, and it's not like your typical 30, 15, 15, 15. We'll do like 100 reps, loaded up to like 60% RM. You're doing it as few sets possible, and you're limiting your rest to like 40 seconds. Like we're smoking them.
That's interesting, because I know that when we do stuff like that as a finisher, we tip, like I would always do the 30, 15, 15, 15. But then for other strength and conditioning stuff, I know Troy has guys do. He's a big 100 reps in as few sets as possible. So that's interesting that you're kind of combining the two things.
Yeah.
And you think that works better? That gets some more of a stimulus than anything else, because it's pay the man, it's get after it. It's like, yeah, this is a lot of reps, but it works with the athlete's level of what they can tolerate, because you can't be inside their brain. So if they can hit 50, 60, 20, 10, 10, do it. Like,
yeah, I nothing against 30, 15, 15, 15. I think it's really good. And oftentimes I use it often, but oftentimes I'll use it as like an entry point to BFR, just because it's kind of that like standard protocol. And it still sucks. Like there's no way around. BFR sucks no matter how you do it. But I like using BFR. Like sometimes I'll do like 5 sets of 15 with BFR. But like the goal is to have like sets 1 and 2, like yeah, you're gonna feel the burn, but like sets 3, 4, 5, like you might not even get all your reps. Like especially set 5, you might only get 10, 12 reps, and that's fine. But like that's the goal, is to push to like ultimate failure. You know what I mean? Yeah.
Yeah, we deal with, even now, so much. There's always someone that comes in post ACL surgery, and we work with their PTs and kind of try and be in communication, make sure we're with them. But that's something that I think is not really understood, because especially when you get that first or that early ACL injury, say you're in high school or right in college, where everything seems like it's this, oh, I blew out my knee, I'm done. Like, this is going to be horrible. There's kind of a misunderstanding where, you know, with some injuries, you have to be a little bit cautious in terms of like load bearing. But I think especially what we've seen with the ACL is the guys who push themselves the hardest, even with there can be minor discomfort, probably because of muscle atrophy and they're getting back into it. But the guys who push themselves the hardest with their kind of return to play stuff, once they're kind of are fairly unrestricted with strength and conditioning, make the most progress. They come back the best. And the guys that kind of, you know, drag ass and I got to take care of it, like they kind of treat their knee as if it's made out of glass because they had that one event. And I think that is something that can be lost a lot with, you know, physical therapy and returning back to sport. Is you kind of have this injury and then all of a sudden the athlete, from a psychological standpoint, is treated like they're made out of glass because they could have torn the ACL or sprained a ligament in their ankle playing basketball or volleyball or whatever it may be. And then it's almost that mental barrier of overcoming it, as in, you know, or more so, hey, I'm not made out of glass. I'm going to get hurt playing sports. I need to get myself back to be more durable. I need to understand what I wasn't doing before that may have led to this. But that seems something that I think Troy and I run into a lot, is that mental barrier of they don't want to push it too hard because they don't want to take any steps backward.
They're scared of getting hurt now and so forth.
Yeah. I was going to say, I definitely run into that all the time. And I think one of the biggest things is, like, I mean, on my end, patient, but you guys, athlete, like just education of whoever you're treating or training, right? I can think of a kid right now. ACL, he's like 3 weeks out, and he's pretty much unrestricted at this point. I was working on bending his knee the other day, and he was like tensing up. He's like, oh, I'm scared it's gonna pop. Like, I'm like, dude, your knee is probably as strong as it's gonna be right now. I was like, the ACL graft is the strongest between like 4 and 6 weeks. Like, it's not gonna break.
Yeah, you're not tearing it again right now.
Like, yeah, and the other thing with that is like carefully grading exercise to build confidence for return to sport, right? So like we're gonna like hammer quad after ACL is like the biggest thing. And one thing that I like to do, I mean, we don't usually test till at least like 3 or 4 months post-op, but like quad testing is like huge in ACL return to sport and return to run especially. And I think it's good if like you get like a good objective number, and I guess this can kind of lead into our force plate test or conversation, but we use inline dynamometers as far as quad testing goes, and I really like using them because it gives the athlete something to look at, to be like, okay, this is what my uninvolved side's at, this is what my involved side's at, like what do I need to do? Like, it keeps them motivated, all right? Like, because it gives them something to work towards, you know, like if their left leg is kicking out, you know, 110 kilos, but their right leg's only kicking out like 85 kilos, like, okay, you're at X% limb symmetry index, like we need to bump that up to at least 80 before you can run. Like, you got to come in and start paying the man, you know what I mean? Like, yeah, I think it's really important. Patient education is like, you know, day one all the way up through return to sport.
100%. So we coined you as the strongest physical therapist in America. And before I move on to my next question, you got to spit us some numbers so people actually believe us. So real quick, go ahead.
Do you want all time or right now?
Tell us how much of a beast you are.
Yeah, all
what you
time.
Repping out on bench? What's a squat looking like? All time. What have you hit? Show your credentials.
I'm actually probably not too far off from all time. All time bench was 485.
Beast.
All time squat was 565. Beltless, sleeveless.
Okay. Pretty
Legit.
good. Very legit.
And he goes, Raynor's at ATG, ass to grass squatter.
Ass to grass, beltless, sleeveless, 565 squat. 615 deadlift. And then my new challenge, I've talked to Troy about this a couple times, is to pull 600 deadlift double overhand, no hook grip. That's my new
No hook grip, no straps.
No hook grip, no straps, just raw strength.
Man hands.
No
Yeah.
belt either. I'm not a belt guy.
So Brett, safe to say, with those numbers, has a very good understanding of strength and conditioning and how to train, and a great strength and conditioning background, right? How do you feel like that has helped you in your now going into PT and stuff? And what things in strength and conditioning are making their way into PT that you've seen, and what things in PT are making their way into strength and conditioning?
So to answer the first question, I'll probably forget the other two, so I'll probably have to ask you to repeat them. But to answer the first question, wait, what was the first one?
The first one was, how do you feel that your knowledge of
strength
strength and
conditioning,
conditioning is helping you in your new your PT world now? Like
Football guys.
Yeah.
Brain.
Yeah.
Short-term memory. It is what it is.
Yeah, so it's huge, right? Like, I'm a big fan of, like, you can't talk and I know you guys are the same way. I see it on your Instagram all the time. Like, you have to be able to preach what you can do.
Practice what you preach.
Do what you can preach. Yeah.
Yeah.
You know what I'm saying?
Yeah.
And I think, like, it helps a ton in the rehab setting, especially, like, going back to that ACL when I'm hammering guys and they're puking in the trash can, right? Like, it gives me some sort of, like, empathy to be like, I know how you're feeling right now. And then it gives me, like, reassures them of, like, okay, like, he's been through it. He knows what it's like. Like, I'm not alone in this. You know what I mean? Like, and as far as just, like, general programming, like, I think most PTs, and it's amazing how many of them don't have a basic understanding of just, like, simple strength and conditioning principles. Like, that should be priority number one. I mean, should be a top priority in PT school. And it's really one of those things that, like, we cover it in PT school, and I think my school covered it a little more just because we have two professors that work in high-level sports, Big Ten sports settings. But, like, I know tons of PTs, not necessarily my clinic, that it's like you ask them what rep ranges they want to do for strength or power or what percentage, and it's like they're kind of scratching their head like, I don't know. And it's like that needs to be priority number 1, 2, 3. Like, as a PT, we're like an exercise-based profession, right? I mean, in the outpatient setting, at least. To not have a basic understanding of strength conditioning principles is kind of insane to me.
No, I agree. I feel like all what you're saying, Otto and I have talked about before, like all PTs should have a basic understanding of strength. Like, and I just feel like your wide knowledge of strength and conditioning is going to help you significantly in your PT world.
Yeah, and I mean, sports PT world's a little different because most people, like in the sports world, for my company, for example, like they all, or 90% of them, have a background in like college athletics or some sort of athletic background, and they all have some sort of strength and conditioning background. So sports PT is a little different, but even just like the general PT, like your run-of-the-mill PT that a lot of these, post-ops go to, it's like these guys just don't really have the basic understanding of how to load the body properly and understanding recovery and all the different things that go into it. And that's why you see guys, going back to the ACL thing, but, 2-3 months ACL and they're still doing like a straight leg raise lying on their back with no weight, and they have an extensor lag because their quad sucks. It's like, what are we doing? That's one of those things that's like a huge pet peeve of mine. But yeah, I mean, having a background in strength and conditioning is huge. That was kind of the end of that one.
Yeah. Well, that reminded me of a story that we had an athlete, I think it was an ACL, something having to do with the knee. It wasn't, I don't think it was official. It was kind of like, we were managing rehab. It was an injury, but it wasn't, officially diagnosed. It wasn't post-op. It wasn't anything like that. And Troy had written him his rehab protocol, and this is what you're going to do. And there was some, not quite belief, this is really hard. This is kind of uncomfortable. I'm not sure if I should be doing that. So I think he went up to get some other rehab protocol, and, Harvard medical professional, like had all the degrees, had been in the field for 20 years. And then when I saw the rehab protocol, it was
banded clamshells and
no, this will surprise you. It was the exact same thing that Troy had written for the kid. It was just like
classic.
The only difference was, I just think that
it had the Harvard stamp on it.
Yeah, the approach to it was, I don't know how well it worked or didn't work, but sometimes the approach is, there is no easy way around it, and it's just kind of like the way to solve your ailment is through.
I mean, especially like any post-op in that mid-stage part, like you're gonna have to just load it up, and it's probably gonna be a little sore, and it's probably gonna suck a little bit, but like that's kind of just the nature of the beast. And I that's the saying I say all the time. Like people will be complaining to me of like, oh man, my shoulder's sore. Oh man, my elbow's sore. My knee's sore. And I'm like, yeah, man. Like, unfortunately, that's kind of just the nature of the beast. But this is just like what we got to do. Like, it's just what's going to make you better in the long run. I was like, trust me, you'll thank me in 3 months.
Well, it's funny because you mentioned, oh yeah, this is sore, that is sore, and moving. Just not even specifically in PT, but you complain about my legs are sore, my knee, my insert whatever ailment you want is sore. It's kind of a tough pill to swallow, maybe for some people, but you're either going to be sore from training and doing shit with your body, or you're not going to be doing shit and you're just going to be sore later for other reasons, right?
Yeah.
Like low back pain. Low back pain is one.
Table. Sorry.
I keep. We've been trying to get better at talking over each other. We're okay. We're not the best.
Brett said you're just going to end up back on the operating table.
Yeah, exactly. Well, I mean, what's the most common pain and ailments? It's like back pain and knee pain, just in general population. So, if you're an athlete or if you're not an athlete and you're just training to get stronger, you have two options. You can either be kind of in moderate amounts of pain here and there and be strong and kind of understand how to fix that pain with doing different movements and just understanding biomechanics, how your body works. Or you can say, well, that's uncomfortable, I don't want to do it. And then the inevitable weakness that you're going to run into is just going to cause pain in a different way. And yeah, like you said, you're just going to end up on the operating table for some degenerate something that you have for like improper movement and lack of strength in whatever area you're neglecting to do. And I think that that's something people kind of have to come to grips with is no matter what you do, you're going to experience like physical discomfort, whether it's living a sedentary life and not doing stuff because it hurts, that will end up resulting in pain and discomfort, or training really hard and pushing yourself, that will also result in discomfort. And then it's kind of up to the individual and for if they're in PT, for a DPT to decide what the threshold is for that individual and what they can manage. And that's kind of where
it's funny you mentioned back pain. I've seen it so many times, and I have a couple people right now that I'm treating that it's back pain, but it's like tough. There's like there was never like an insidious cause. It was just kind of just like a gradual onset. Very like sedentary lifestyle, don't do much. And it's like all of a sudden I give them just like kind of just a general exercise program. I mean, catered to the back, catered to the core, catered to the legs, but overall just a very general exercise prescription program. They come in 3 times a week and just start moving their body significantly more than they have. And in 3 weeks, they're like, oh my God, I feel great. I'm like, yeah, imagine that. You've moved like this in ever. And now all of a sudden you're moving and you feel good. It's like connect the dots. You know what I mean? Like, and that's not hating on these people. I just,
No, we completely understand. We have kids that come off the couch and like, oh, this hurts. Like, you need to move. Like, you are so out of shape. You need to move and do more things. The second half of that question that I asked was, what things are you seeing now from strength conditioning make their way into PT, if there is any, and what things from PT are now making their way into strength conditioning? So like one of the things we've talked about before was the force plate and the VBT. And I don't know if there's other things or if we just want to touch on those two.
I think as far as things going into from PT into strength and conditioning, I don't know that there's much. I think it's kind of a gray area, right? Like, force plates and VBT are a great example because I don't know if one started in PT or one started in strength and conditioning. That's probably just my own ignorance. If I had to guess, probably strength and conditioning, but I don't necessarily know if it's like this was adopted by PT and now strength and conditioning is taking it over and vice versa. But as far as things that are used in both, I mean, force plates is a big one. You see that all over social media, and same with VBT. And I know as far as like training and PT, oftentimes people have very different outlooks on it, and I know we probably have different outlooks on it. I want to be very clear. I'm not live and die by force plates. I'm not live and die by VBT. I think they have an excellent usage in rehab. However, I don't think it's not necessary. It's a great tool if you have it, but at the end of the day, they're very expensive, and it's a lot of data to consume as a clinician, and then you have to learn to relay that to the athlete or whoever you're treating. And truth be told, I'm not the best at it. I mean, it's a lot of data to interpret, and I can do enough. But I mean, there's people out there that are significantly better at it than me. My supervisor at College Park is a great example. He is a force plate wizard. But with that being said, in the rehab setting, I think both are really useful, and I'll start with VBT just because I think it's a little more straightforward. So what I usually like doing, keep using ACLs because I think it's a good example and it's super common. Between months like 2 and 4, it's just hammer strength, hypertrophy, like just bury them into the ground every session pretty much. After that phase, usually it's like a week-ish of a deload, let them recover, and then before they get to impact loading, which is when their quad is usually around 80%, is when I really start hammering velocity-based training. My clinic does not have, I don't even remember what they're called, but the string thing with that measures like bar speed and stuff. But I still think you can use velocity-based training without that. Like I don't necessarily think you need the fancy.
Well, we have the OVRs, 2 OVRs of a Truve, and then the other ones is the Tendo unit. That's the
Tendo. We have
yeah.
I was gonna say Tindec. Tindec is the thing we use to measure isometric strength, but I think the principle's the same, right? Like it's a great tool, and I wish we had one, but the goal for VBT is move the bar fast and move it within this range of meters per second or however you're tracking it, right? And when we're in that phase of speed, power before impact loading, it's like we're trying to train this athlete to move quick, not necessarily get off the ground because we can't yet, but just produce that fast twitch fibers as we've, been hammering hypertrophy for the last 6 months. They might have lost some. But yeah, I mean, VBT, like I'm less versed in it as far as a strength and conditioning setting, more so in a rehab setting. But I think, there's tons of similarities in both. I mean, the goal is to move fast and get the athlete faster, right?
Yeah. With the force plate, I can speak for myself.
Yeah, let's get into force plates. Well,
with the VBT coaches, Coach Otto's been doing a great job of the implementation of the VBT and using the OVRs and Vitruve in our training and getting, like you said, guys to just move faster because that's what we want. We want to recruit more type 2 fibers and move as fast as possible and get guys moving as fast as possible, like every day. And coach has thought out a way to make that happen. And I think it's been super successful so far, and it's helped us in our training. And so VBT is definitely massive for us.
Yeah, we can wrap up VBT. It seems like we're all in agreement. Velocity-based training.
Great.
I had an aha moment. I think it was when we were training Josh and Phil, when we had them doing some speed work, and a lot of it was just getting them to move fast. And so I thought of this while you were talking, Brett, was how often do you see, because I guess when you're returning to sport, a lot of times, like you said, you don't necessarily have the measurement because it's not that important. They just need to move fast.
Yeah.
Where we're trying to move them to get that PRs or top speed, it's good to have that range where we have like an actual metric we're looking at.
100%.
But do you find that when guys go through these rehabs and you're teaching them sometimes just strength and conditioning fundamentals, but then also implementing, techniques like VBT and moving fast and just being aware of your body, do you find that they come back or they go back to their sport and see more success just as an athlete? I'm curious if what you've seen, because from the way I'm hearing it and what I could guess, if I were to guess, it would make sense that a lot of people after going through a program like that would see benefits, because prior to that, it was something I had to realize, because for me, it was one of those things. Obviously, you have to move fast. I only care about moving fast and being strong. Like, that's all I care about. But for a lot of athletes, there's so much information bombarded at people from social media and just all kinds of, like you said, people that are professionals but don't have a fundamental understanding of strength and conditioning, where it's like, what do I listen to? So I guess the question, I kind of rambled on there, is do you see athletes with more success when they go back to sport after they go through a program with you rehabbing from, let's say, an ACL?
I mean, I'm still a new grad, so I don't have the confidence to be like, yeah, dude, this guy killed it with me And maybe I'm misinterpreting your question.
No. Well, maybe from someone else that you've seen. It doesn't necessarily have to be a client you work directly with, but just from your experience, you hear stories, you talk to mentors and advisors and all types of people that go through. You've learned ACL not only from yourself but through other people. Do you see when someone comes back? It used to be years ago, even before like we were in college, but it used to be just that's your career. Do you see guys coming back from ACL? Because I know a few people that have come back from ACLs and had more success on the field than previously. Like they were better athletes after they really dialed in and, like you said, learned and educated. So do you hear a lot of stories? Is that kind of a sentiment that you'll be better when you come back because of this training that we're doing?
Yeah, and one of the things that my supervisor at College Park told me, and it really, really stuck with me. And you can kind of interpret this a couple of different ways, but we had a guy, wasn't an ACL, but it was, he had just like chronic patellar tendinopathy and like 2 or 3 years chronic. Like it was bad. I didn't rehab. I helped a little bit in his rehab. My supervisor kind of had mainly seen him, and he got him to a point where he was like solid. He was a lacrosse player, solid, was able to practice 5 days a week, playing games. Like he was good. And then he had like one incident where I don't remember what happened, but I think he just went to cut and just like instantly sharp pain in his patella, like crippled essentially. And he had been killing his rehab. My supervisor was smoking him, and we were kind of talking about it. I was like, man, like what, like, why do you think that happened? Like, what's going on? He's like, I don't know. Like, his numbers were good. Like, everything was really, really good. And he's like, what he said to me, he's like, that's why you never take credit for someone's rehab, because you never know what can happen.
Anything can happen.
And I was like, I never thought about that. I was like, man,
injuries are weird.
Yeah, I was like, man, that's really cool, because like it's really easy to be the guy that's like, man, I saw this guy day one post-op, and now he's returned to sport, and you know he's gonna kill it, and I did that, you know. But it's really like he did all the work. I just told him what to do, and that really, really stuck with me. And I think it's something that's really important for a lot of people to hear, because one,
that's important for us to hear. That's good.
One, I mean, it puts your ego in check, because a lot of people, like I said, like a lot of people want to be like, that guy just had he's an All-American after I saw him, that was because of me. But that person next week might go out and have re-injure themselves. But overall, I feel kind of, to sum up the question, I feel like rehab outcomes are getting better, strictly because, I mean, there's just more data in it now, more science coming out every week. There's a new article published about best way to rehab a hamstring, best way to rehab a shoulder, best way to rehab XYZ. I still don't think that changes, the basic principles of rehab, right? Like the basic principles of rehab, you have to progressively overload within a safe manner, right? Like, however, I think with a good clinician who knows what they're doing and can stay relatively up to date on research, which I try to do as much as I hate reading it, you should see better outcomes over time.
So now to our force plate discussion. Here is my main issue with it. This is me personally, and Coach Otto's may vary. It may be similar. One of my main issues with the force plate is strength and conditioning places, not PT places, strength and conditioning places will use their force plate to justify charging more money by putting youth athletes and whoever that don't need it. It doesn't matter for their training. Those numbers don't matter for them. Like, this kid can't walk straight. He needs to friggin' squat. Like, his counter movement jump shouldn't matter. And that's why are you charging now like $1,000 a month for this 10-year-old kid to jump on your force plate? That is my main issue with it. And that happens. I see it all the time. Like, that's more often than you think. I feel like I see that at strength conditioning places. That's one of my main issues with it. I don't know if Coach Otto's varies at all, if he has an issue with it at all. But that is one of the things that bothers me with it.
Yeah, I think I don't have an issue with force plates per se. I think when we talk about issues and why I would usually say I'm not a particular fan is because, like you said, Brett, there's so much data that you can get from it, right? They're really sensitive devices. But what seems to me what happens is you take a tool that's extremely elaborate, and then if you don't know what you're looking for, it seems to me that people get really excited about all the data they get and try to prove causality or justification for what they're doing based on all these metrics that the force plate gathers. I think that, like anything else, it's neither good nor bad. And I agree with Coach that I think it's often used by people who don't even have fundamental understanding of progressive overload and strength and conditioning, like just principles of training. They'll use, or maybe they do have fundamentals, but they're trying to find that secret sauce by using a force plate. And this is more specific for the training aspect of it. I can understand where that application comes with rehabbing when you're testing, deficiencies between, inequalities between strength of the left or right leg and just what an athlete is. But it seems like in strength and conditioning, they'll try to take a bunch of data and look at the graph or look at all the numbers and say, this is going up because of this, or this is happening and that means this. And I'm a big anti, try to just let me find the right words. To try to prove causality out of your own brain without actually doing it. It's not an easy thing to prove anything, to justify any way that you're doing. All you know is really, if you work hard and keep doing the thing, you're going to get better. So I think that it's a fancy tool, and it's just kind of a way to make people who don't have access to that kind of money, because what are they, $20,000 to get in the strength and conditioning field? When you have that, it's more of a status symbol to show on this level versus do we really need a force plate to show that they're generating more force? That's why I like the VBTs, because the speed measurement units, because you can show how much force an athlete's producing. It's cheaper, it's more versatile, and you don't overwhelm an athlete with a bunch of different data points that may or may not benefit them for understanding, which I guess is where guys like you come in, where you do the work of trying to take that and translate that in terms that an athlete can understand. So I guess that's really where the job comes in. But I think sometimes people use that, and everybody always likes to sound super smart and super professional, especially with the strength and conditioning and training and rehab world, because I think all three of us can agree that as smart as you sound, all the terms you use, at the end of the day, lift weights, work, like you said, pay the man, put the reps in and move forward. And that's, unfortunately, for all of the guys that love the elaborate literature and science, that is just the reality of
vernacular, and
that's just the reality of training. At the end of the day, you can do the best rehab ever, and a guy across from you can still punch you in the mouth, lay on your leg, and break your wrist. It's just going to happen.
Yeah.
But I am curious. So that's my very complicated stance on force plates. They're not bad. I just think that they're not necessarily used in the most beneficial way for strength and conditioning. But I'd be very interested to hear on how PTs use it, because I can see that all that data would be helpful, especially when you're trying to get someone back to where they were, or just to maybe try to understand where an injury came from. That I think is kind of interesting. So
yeah. So first I'll address Troy, because I know Troy and I have talked about force plates. I didn't realize that, probably just because I don't keep up with it on Instagram. I didn't know necessarily that gyms, for whatever lack of a better term, use it to market for come see me because we have these. That's just my own personal ignorance. I didn't. It makes sense that people do that, but I genuinely didn't know, which I understand that's bullshit. The fact that you're saying, yeah, we have force plates, come see us. It's but do you even know how to use them?
Exactly.
Do you know because I've used them a ton. And I still there's a lot of the data that I still struggle with interpreting. It's a lot of stuff, and it's really hard to comprehend. But so as far as a rehab, how implementation, I'll give a good example, because I think it really it shows how they can be beneficial in rehab, but not overcomplicating it with the overwhelming data that it shows.
Yeah, educate us.
Yeah, so I love this dude to death. I had a lacrosse player who he was dealing. Actually, I did a case report on him, which was really cool. He had a chronic hammy issue starting last October. He was practicing and just felt the strain and was oh shit, whatever. Did a little rehab with the AT staff. Went home for winter break. Didn't get better. I saw him week 1 of spring semester. So they were preseason for University of Maryland's like legit lacrosse season. I force plate tested him on like the force. I mean, there's Valve is what we use. They have a bunch of different things like the Nord board, the force decks, the whatever, you name it, they got it. But so I did what's called a run specific hip iso push. And I think that was made famous by Alex Natera. I don't know if you guys are familiar with him. He did a lot of research on hammy rehab. But so we did that test, and it's essentially shoulders up on the box, barbell across the hips, loaded up with weight so it's immovable. You're in like 30 degrees of knee flexion, and you're essentially doing a single leg glute bridge, long lever, so it biases the hammies. Pretty straightforward test, but where the force plates come in is it shows peak force and it shows rate of force development, which we haven't really talked about, but I think it's important for this. And that's where I think force plates can be beneficial because so this kid, his peak force bilaterally was off the charts. I mean, he was like 99th percentile for college athletes. And I'm looking at him and I'm like, why? Like, you're injured. Why is your peak force like insanely high? But his RFD sucked. So when I'm looking at the graph, and I think I actually sent Troy a Snapchat of the graph like way back. His left leg, yeah, it was right.
You sent it to me and you said, "Does this piss you off?"
Yeah.
You're like, "Does this force plate make you angry?" I was like, "No, you don't understand. That's not why I'm mad."
So, but yes, his RFD on his left was really, really good, but his RFD on his right was shit. So long story short, you train RFD in a program, in a rehab protocol. But to kind of sum up this long story, the force plate gave us a really, really good way of measuring RFD in a way that we wouldn't necessarily have been able to without it. I mean, I'm sure there's a way, and I'm probably just, I'm a young new grad and still ignorant to a lot of different methods, but we had it, and if I have it, I'm going to take advantage of it. And it gave this kid, like, I could show him the graph and be like, look, this is how long it's taking you to get to your peak force on your left leg, and this is how long it's taking you to get to your peak force on your right leg. You can visibly see the deficit, and being able to show him that, he's like, okay, yeah, like I get it. And there's obviously, I mean, there's a ton of other data it gives me, but like it's not necessarily relevant. The thing that I'm looking at is RFD.
What's a standard? What is RFD measured in? Like, what's a number that, like, so, what are the units? Like, say Coach Troy is doing the test. Like, what would that be? And say, like, do you measure it for, like, a counter movement jump, like a CMJ? Like,
no, CMJ, we do RSI. So, like, basically how quick you can get off the ground. We want to measure, like, as minimal ground contact as possible. RFD, it's time to peak force. So I want to say it's like.
So when you start the contraction, if you're in that movement, from when you start putting force into the plate until you have like the maximum amount of force, that's how long it takes for you to kind of build up and push.
So the goal when you're looking at the graph, RFD, for him example, his left leg, it was a super, super sharp spike to his peak force, which I don't remember the number, but it was crazy high. And then his right leg, it shot up, and then it kind of slowly climbed to his peak force. So his RFD on his right leg sucked. But yeah, exactly. So I don't remember the exact norms of like how long it should take you to get to your peak force. I know it's less than 500 milliseconds. It's a very, very, very short period of time.
So go ahead, Coach.
So I guess my question is, and there's no right or wrong answer. I certainly have no idea. This is a question for you. Do you think that is more so because the athlete is hesitant because of an injury? Do you think that's more of a psychological thing than it is the actual like firing of the neurons to get that muscle contraction? Do you think is that where you find the most benefit in using that, where you're not attacking, you're not able to drive force because do you think it's more, I guess, yeah, that's the question. Is it more of a physical factor or is it more psychological coming back from an injury?
I think
because you probably pair it with strength testing too. You might say
we did. I mean, the test we did measures on the force plates, they obviously measure everything. It measured peak force and RFD. If I saw a huge deficit in peak force and RFD side to side, I would be like, okay, maybe it's more psychological. And if it was pain free, right? Pain is obviously a huge indicator of, okay, this kid can't put out a ton of force because he's in pain. But he was completely painless and was able to push for 4 seconds as hard as he possibly could. And I mean, you could see it. He was straining. Can it be psychological? Probably, especially if it's a confidence thing coming back from an injury. I think that would be more so RSI if you're looking at like single leg counter movement jump or depth jump. But as far as RFD, like, you know, numbers don't lie. And especially like I said, pain is a huge indicator. I'm not saying live and die by pain, but if he's pain free and he's able to do it, I don't necessarily believe that it's psychological. That's my own personal belief. Could it? Possibly. But if we implement a protocol and we see improvements, then we know, you know, we're attacking the right thing. But if we implement a protocol and we're seeing, you know, no improvements, as RFD still sucks, and okay, maybe it is all up here. You know what I mean?
Well, I wish I had my RFD from, I tried to pull up my notes from when I got a counter movement jump tested at Lake Placid at the OPTC, but I just have, I think, height, peak force, and
yeah.
Unfortunately, I didn't write down what any of these numbers. I have a bunch of numbers. I think, is there one like
was this counter movement jump or was this
CMJ? Yeah. So I didn't record the RSI. I don't think I think this is force to weight ratio or something. It's a score of like
not necessary. I mean,
yeah.
But for what you're saying, Brett, in the talk of like how force plates used in PT versus how it's used in strength conditioning, I guess. But for what you're saying, it makes sense. Like you need you need those numbers as a PT to understand where a kid may or may not be at in his, you know, return to play protocol and so forth.
Yeah, and if a kid has a huge RFD deficit and if I have him, you know, return to sport and he's sprinting full speed and he can't produce the force, like he's gonna be slower, he's gonna be more prone to injury. Like it's just it's a recipe for disaster. And I'm not saying like I needed force plates to see that measurement. It would have been probably a little more difficult rehab without it, but I still think the kid would have been fine. I mean, it helped that he was a stud, but like, you know, it's beneficial in rehab when you have something like that can tell you something that you can't necessarily see with the naked eye. Like all the objective measures, range of motion, I mean, not that I really like it, but like just manual resistance strength was all good. And then we did a running eval and he was, you know, looked great. So it was kind of like, well, you know, where do I go from here? And, you know, it was like, all right, well, maybe he can't produce force very fast. And that's, you know, potentially the reason why he's being limited still. And sure enough, his RFD sucked. And here we are. Now he's killing it. Now he's about to go play in the Final Four.
So that makes sense. I think that is a great conversation about force plates, because what it sounds like is it's a very effective tool for rehab and physical therapy. And for strength and conditioning, I don't think it's going to make you jump any higher, frankly. So I think that the opinions are fine. I can see there are those values come in and why it makes sense. But like Coach Troy said, you'd be better off not wasting your time on
the jumping. Gets interesting, especially post ACL, because you can see side to side. That's when you really start to see confidence come into play. Because you can see like how they load the foot, if they want to adopt a more knee strategy or a hip strategy. If they're not confident loading their knee, and then obviously RSI, how quick they're getting off the ground. Like if there's a deficit there, then you know to address it. I would say we use it more jumping than anything else. You can just get creative. I mean, I did it with calf strength, hamstring, jump. I mean, you can get really creative with it. It's a lot of fun.
I think barbell's king.
Barbell.
Would you rather?
I agree. Barbell is king.
Would you rather have a force plate or a back squat?
If you could only pick one.
Probably back squat. Well, honestly, probably front squat. I've changed my.
Okay, force plate or a barbell?
Barbell.
Yeah.
We should put together all the front squat. The guy that we had on last week.
Love
USA bobsledder, Karsten.
Squat.
Huge front squat fan.
I have become a big front squat guy in the last like year. I really haven't back squatted probably more than 3 or 4 times in the last year.
Interesting.
Any particular reason?
My back hurt.
Too many inversion.
Dude, I was just like I had what I think is a spondy. So I think I have a small fracture in my back. But so I've been rehabbing it myself, and I just got off back squats for a while and just started doing front squats. just reduce some of the axial load, and
It's
then
good to take breaks.
Found a safety bar, and now I'm loading it up again. So, but I feel fine.
What we haven't covered, because that was great, first of all.
Yeah, that was great.
Brett-
That was outstanding physical therapy
Hey guys,
conversation. Okay, yeah.
Okay. No,
Sorry.
I wasn't going to segue into another piece. No, go ahead. Question, go.
Well, no, this is important because my phone's gonna die.
Oh,
Go
Yeah,
plug
can I
it
go
in.
grab my charger?
Yeah,
yeah,
run, go.
Yeah,
All right.
yeah.
I'll time you.
We can fill dead space.
We'll cut. So if you notice, Brett behind him, it looks like he has a pull-up bar and a dip tower with a Roman chair for your leg raises and a heavy bag.
Yeah, to punch. I don't know. People don't really see it, but I don't think we'll use this for a
Fair,
clip.
yeah.
But if you're listening,
Yeah, that's
we can
bad
fill
radio.
it in.
That's bad radio.
No, I can think of things. If you're listening, Brett left to get a charger. But interesting. Ultimately, when we talk about tech, because I can see how people could
Oh, it's
take
back.
that Coach Troy and Coach Otto are very anti-tech when it comes to training, and that is true. However, you should keep in mind that all technology in training, strength and conditioning, and in rehab is just tools. And those tools are like, I feel like this is just so cliche and oversaid, but those tools are only as good as whoever's implementing them and using them. So if you got a PT like Brett, who knows his shit and knows how to use that stuff and is going to get you strong and back on the field, awesome, great. However, you'd be better off getting a guy who knows his fundamentals of progressive overload and strength and conditioning to get back on the field versus someone who's using a lot of fancy equipment and
Doesn't fucking know.
metrics
Yeah.
to try
100%
to
agree.
explain things to you. That really that doesn't know how to do basic movements. If they don't lift easy, right?
You don't even lift.
That's the first thing that you said. If you're advising someone about everyone will take a lot of time finding the best surgeon, but if you're advising someone about their physical therapy and return to sport protocol, it's more important that you really take the time and find someone who knows, one, how to return to sport from an injury, two, understands strength and conditioning fundamentals, progressive overload, and three, is not a complete asshole and you can spend a lot of time with, or you're not completely bored with. If someone's just regurgitating advanced metrics and trying to convince you like, hey, that's awesome, but you can't relate to them or you don't feel that you don't trust them, then you'd be better off going somewhere else. You'd be better off getting some guy who's been training people for 20 years and is strong as shit. You'd be better off going to Louis Simmons at Westside Barbell for some things.
Rest in peace.
Rest in peace, that reverse hyper, right? How many spinal surgeons, couldn't stay? Imagine having back pain and going to,
Louis Simmons.
No. Well, there we go. Imagine having back pain and going to a guy who, squats, 225 with really good form, but that's his all-time PR squat, 225 or 185.
He's never dealt with any type of
he's
pain
doing
in his
all
life.
these things to your back to try and fix you, and you can't do it. And then you roll up to Westside Barbell, and Louis Simmons says, "Here, just lay on this thing and swing your legs, reverse hyper it away." And all of a sudden, Louis Simmons with his tattoos and in Westside garage completely cured your year-long ailment because he swung your legs with some weight and got some spinal decompression and distracted the joint a little bit. Solved everything. This is how you should squat. This is how you should bench. I think that that's lost on people because they're always looking for some elaborate answer, and training, performance, and sports is not very elaborate. Well, it is, but for your average Joe. Let's get into jiu-jitsu.
Yeah,
I want you guys.
that's what I want to
hear
I didn't know if
about.
you wanted to segue into
That was the
it,
segue I wanted
Yeah.
to talk about because that's
Yeah.
not my world, but I know both of you guys are strength guys, and you're both, from what I hear, very good at
Don't
jiu-jitsu.
say you're not a strength guy, dude. I've seen you RDL like 600 pounds. Get out of
Oh
here.
no, I am a strength guy, but I meant more so the overlap on the Venn diagram of strength guy and now former football player, current
yes.
jiu-jitsu athlete, and I am fascinated with the jiu-jitsu world.
So I started jiu-jitsu because of Brett. I saw Brett start jiu-jitsu, and I started like 2 months after him. I saw that, and I was kind of looking for a new outlet because I did powerlifting, and I was like, I don't really like this. And football was done, and I needed to compete and like be aggressive and be able to like do things and use my body and like beat people up in a sense. And I saw Brett started doing jujitsu, and I remember messaging him and being like, "Do you like it? Like, how's it feel? Like, blah, blah, blah." And he was like, "I love it. It's awesome." I'm like, all right, great. And then that's kind of when I started. But I know Brett is a big jujitsu guy. So tell us a little bit about how you got into that and how you're doing with that now. When's the next tournament?
That's good questions. How did I get into it? I remember because I know when my check hits every month, it's the 16th of every month, or my bill, I should say. I started December 16th, 2022. So I don't know, two and a half years-ish. I've been training. How did I get into it? Well, a huge Joe Rogan guy, huge Jocko Willink guy. Both of which are huge jiu-jitsu guys. And I mean, I've listened to each of them, probably every single one of their podcasts, and they never fail to bring it up somehow. And I was like, seems cool. Like, just, manhandle someone and they have nothing to do about it. Like, so I was like, whatever, I'll sign up. I talked to my cousin who knew the owner of my gym because they went to high school together, and he's like a multi-time IBJJF world champ, which IBJJF is like kind of the gold standard for jiu-jitsu competitions. And he was like, yeah, man, like, go check it out. So I was like, all right, whatever. So I shot down there one day after school, did a no-gi class, and was just getting absolutely like, I was like 225 at the time, like yoked, like pretty much how I am now, just jacked. But I was getting mangled by like 160-pound dudes, like literally like choked. My fiance was there, and she was sitting on the couch, and I was like, dude, this is humiliating. Like, I'm getting choked out by like these little dudes, like, and there's nothing I can do about it. I was like, this sucks. But it also, the flip side of it was like, man, how cool would this be to like be able to do this? And like, I was day one hooked. It was like a trial class, and my coach came up to me after, and he was like, man, how'd you like it? I was like, dude, sign me up. Like, I am instantly hooked. So yeah, I mean, from there, it's kind of just been, I train at least 3 or 4 times a week, every week, and then started competing literally a month after I started training, which was kind of probably in hindsight a mistake. But there was like, I started like mid-December, and there was a tournament like first week of February. It's like a month and a half, 2 months after I started training. I knew nothing. And a bunch of guys at the gym were doing the tournament, and I thought I was good at the time. And just like everyone in jiu-jitsu thinks they're always good, and then a year down the road, you realize you still suck. And I was like, yeah, man, like, I'll sign up. And I didn't even know like what guard, like, I didn't know how to pull guard. I didn't know how to do anything. So I just went into this tournament and just like fucking just like speared guys, like tackled them like a running back running through the A gap, and ended up placing third, which I was like thrilled with. But yeah, man, I competed a ton, or have competed a ton, I should say. Done pretty well. Got my blue belt in September, I want to say, of last year. There was a tournament actually this last weekend locally. Haven't really been able to train this last month as much as I would have liked to leading up to a tournament, just because of my boards. I've been like living on my computer studying. So I was really only getting in like 3 times a week max. So I didn't really feel like ready to go to a tournament, but I think there's like an IBJJF tournament coming up in either August or September that I want to do. And then obviously like every local tournament I try and do, just because it's local and it's easy.
I was just gonna touch on the fact that like it's crazy like how much I've been doing it for about 2 years now too, and like there's still so much to learn. Like, I'll go to class and get submitted by a 160-pound 55-year-old black belt, and I'm like supposed to be like this big, strong, like biggest guy, strongest guy there, like former Division I athlete, and there's this 55-year-old 160-pound dude that can tap me out at any time, and yeah. I'm like, this I don't understand this. Like, I don't know if I want to get to a point one day in my life where I do understand it, and that can be me, because it makes no sense.
Yeah, dude, my coach is a great example, because he's like, he competes in, I think, like either feather or light feather. He's like 140, 150 pounds soaking wet. Like, he's a small dude. And he's, I think, like 37. So he's not like old, but he's, a lot older than me, a lot older than a 25-year-old dude who lifts heavy every day, and is still in his pretty much prime athleticism. And there was one day I'll never forget it. We were rolling, and right before we started rolling, we slapped hands. I was like, "Yo, like, do you think you could beat me with your eyes closed?" He's like, "I don't know." He's like, let's find out. I was like, "All right." So we slapped hands. He shut his eyes. He literally just sat down on the ground, pulled guard, and I couldn't pass his guard. He took my back and he submitted me in less than like a minute and a half. I was like, "Dude, this is all with his eyes closed." I'm like, "Dude, this is humiliating." I'm like, "This is wild." But like, that's what's so cool about it is like the fact that like he's this like mid-30s dude. Like you see him walking down the street and like the average meathead would be like, "Oh, I could beat his ass." You know what I mean? Like,
Yo, I could beat the shit out of that guy. Yeah,
exactly. And I mean, little do you know, like that dude's a third degree or fourth, whatever he is, third degree, fourth degree black belt that would absolutely manhandle you in less than a minute. And it's like, it's the most humbling, but also like fascinating thing. Cause like, it's like a mental chess match every round. It's really awesome. I recommend it to anyone and everyone, especially in the summer too. Cause our gym doesn't have AC. So in the summer, it's just like,
you get a great sweat.
Dude, it is. The other day, it was like 85 degrees when I went to train. And I put on my rash guard, my gi, and I was sweating before I even stepped on the mat. And I was like, dude, This is bad. But yeah, the cardio's awesome. Like, it's fun. I mean, I'm biased. I think it's one of the most fun things ever. But yeah, it's incredible.
So I have a question for both of you. Compare how jiu-jitsu, because you mentioned, discipline, and it's fun, it's challenging, mentally stimulating, it's hard cardio. It works on not only like aerobic but anaerobic because you have to hold stuff. There's a lot of strength involved in it, and technique. How does that change? What kind of physical and psychological changes did you guys kind of have to reconcile when you started jiu-jitsu? Like, because we all know it's game day football, kickoff defense, whatever you're on, whatever you're playing, you're ready to take someone's head off. It's like pure emotion, violence. Like you're just going to hit someone. You've repped it out in practice. Sometimes you don't even need to do the same technique in practice. You're just going to impose your will on another dude. How is that different from jiu-jitsu, and what kind of things did jiu-jitsu kind of highlight into both of you guys? Because you might have different answers in terms of where you needed to improve, or what kind of things like, whoa, I really didn't expect this. What were the I don't know. I'm curious about the transition from football to jiu-jitsu because I see it with so many guys that I used to play with you two guys too. Like it seems like guys are just drawn to it, but what's so different about it, and how differently do you approach jiu-jitsu than you did, let's say, with football game?
You want to go first, Troy, or you want me to go first?
I can go, yeah, sure. I think what is different is, like you said, in football, like, you're like this every time you're on the field. Like, who am I going to kill? Where's my neck? Where's someone going to come hit me from? Oh, you want to come from that angle? Okay, fine, I'll fucking kill you. Like, that is nonstop. But in class, I guess you can say, in jiu-jitsu, it's less of that and more of an understanding of your body and when to use that anger and explosiveness, understanding when to use your strength, when to use your technique, and also like having an understanding of if you just go out there like, I'm just gonna fucking kill this guy, like, and that's your mindset the whole time, you're probably not. Like, you're gonna blow your load and you're gonna end up getting submitted, especially if you're going with someone who's a little better than you, and you just go out, spaz out, and go crazy ape shit. Like, it's probably not gonna end well for you. So you have to learn. I had to learn at least how to control myself, pace myself, and understand like when to speed up, when to not, when to like use that. Okay, now I'm gonna fucking get you, and when to not, and so forth. I don't know if that really answers your question, Otto, or not, but that is my take on it, at least a little bit.
Yeah, so I have a pretty similar take, honestly. I mean, jiu-jitsu, Troy could probably speak to this as well. Like, it's a mental chess game the entire time you're doing it. So I don't know if Troy does more gi, no gi. I'm a pretty big gi guy. Just because no gi reminds me too much of wrestling, and I did enough of that as a kid. I'm kind of over it. I love the gi. I think it's significantly personal bias. I think it's more challenging. I think you can get caught in a lot more stuff, whereas no gi is more wrestling. But so like, when you're in the gi, which is primarily what I train in, like the littlest change in a grip on your pants or on your lapel, like whatever, can make the biggest difference in what the guy's going to do. So like constantly while you're fighting, you have to think about like, okay, what does he have and what does he want to do versus what do I have and how do I counteract what he has versus what he might grab, and how is he going to counteract what I have and what I might grab. So you're constantly thinking on your toes. And I think like you can't really be that guy that's like screaming down on kickoff. That's like, I'm just going to take the first person's head off I see, because if you do that, like you're going to lose your composure and you're just going to get smoked. I used to.
And you might end up getting hurt.
Yeah.
Like you might end up hurting yourself. You can't just like get into a, like in football, you can be like, I don't give a fuck what this guy's technique is or how he attacks me. I'm gonna run through him. Like I don't give a fuck. In jiu-jitsu, you get into a position, say you try and explode out of it, you might end up hurting yourself even more. Like
yeah. It's funny as far as like going into football games, dude. I was the guy that was listening to like in my headphones like Five Finger Death Punch, Pantera, Disturbed, like blasting heavy metal. Yeah, like just like ready to smash my head into a brick wall. But dude, like before jiu-jitsu, like tournaments, like it's like super chill, calm music. Like I'm in such like a, I call it like a, I mean it's not me, many people say it, but like a flow state. Like I'm so calm walking onto the mat because I can't really have that like huge like I'm gonna run through this guy's face, because one, you're gonna have a huge adrenaline dump, and when you have that adrenaline dump, like that's how my first tournament.
Yourself.
Yeah, that's how my first tournament was, dude. I was like, and I learned a ton. I was listening to, I don't even remember what, just some screamo meathead music, and I walked onto the mat like I'm gonna murder this guy. And 30 seconds into the freaking match, I was like, dude, am I that out of shape? And I was like, no, like I'm an idiot. So now I've just learned to like, it just teaches you to be so calm and cool, and you have to be successful. I mean, like you can't let your emotions take over. It's whereas in football, like if you get pissed off, you can just go run into a lineman's head first and knock him over, and possibly make a play in the backfield.
And then you get a rest after the play. Like you run down the kickoff, you smoke someone, you go to the sideline, you rest. You're on defense, you hit a pulling lineman, you go, in a huge adrenaline dump, you hit him, then you get a rest after that play. If you go out on a jiu-jitsu mat and you drop that adrenaline dump and you fucking, you can't rest. The match is still going on.
A minute in, if you spend all your energy in the first minute, like you still got. I mean, at blue belt it's 6 minutes. You still got 5 minutes to fight. Like, and that's a long time on the mat. Like 5 minutes. Like you think like 5 minutes isn't that long, but like when you're just constantly grappling and squeezing and straining, like 5 minutes is a long time. So you have it forces you to stay calm the entire time.
So do you guys think that these things that you've been learning from jiu-jitsu, do you think that it would have benefited you as football players to have this experience earlier on in your careers? Or do you think it's the kind of thing where, when you're playing football, you have to be kind of, ready to lose it all, like you're just smashing your head into things? How do you think you would have been, like, let's go back and say you were doing jiu-jitsu for a few years before you played college football. Do you think that would have changed how you approached game day for football, or how you practiced or did anything? Would it be worse? Would it be better? What's the difference? I think it seems like it might be a little bit different, because in football, obviously every athlete has their own advantages in football, whether you're bigger, stronger, faster, more violent. And that kind of is nullified more in jiu-jitsu because technique kind of is king.
Yeah. I think it would have helped me, not as much from a mindset perspective. I think football is a different game. So like when I'm on the field, like you said, it is that like, but I think it would have significantly helped me with my balance, coordination, understanding of my body, and like hand placement on things. Like especially if I was at like D end or 3-tech or whatever, and I had to get into that close space and I had used like different I think it would have benefited me in that sense more so than in the mindset of like the like anger.
Got that Dollar Tree Wi-Fi over there.
I think it would have helped my play style a little better.
Yeah, so I agree with Troy. I mean, completely. As far as a mindset, I think there's like certain situations in football where like that like calm flow state could be beneficial. Like if it's 4th and short, games on the line, like you might not necessarily want to be that guy that's like, oh, I'm just gonna run through this lineman's fit. Like, you know what I mean? Like you might have to like, okay, let me analyze the offense. What are they gonna run? What could they run? How am I going to defend it? How can we adjust the D? Like, I think there's definitely certain parts of the game that, like, it could be beneficial. And I completely agree with Troy. Like, the hand placement is huge. Like, framing techniques in jiu-jitsu, like, that's very similar to hand placement, whether you're shucking a lineman or you're pressing a DB as a receiver. Like, pretty similar. But I think, like, at the end of the day, football, like you got to have that, like, I'm going to run through a guy's face no matter what.
You still got to have that.
Yeah, you have that. That's not going to go. That can't go away. But I think that for sure there could be points in the game where you have to be a little more analytical, that I think it could come into play.
Cool. Well,
I think that's great.
I think that's great. That was a really fast hour and a half chat.
Is that an hour and a half?
Yeah,
Yes.
you crushed it. But
that was awesome.
Before we wrap up here,
what?
We'll do some fun questions.
Yeah. We can do some
Coach Troy, because
we can do some Q&As
I got
quick.
I got questions for you guys too. So
okay, great. I'll ask one, then you ask one.
All right, deal.
Ooh, tit
Okay.
for tat, I like that.
Yes. Tit. Okay. So this comes from someone on Instagram. Okay. Best Chipotle order, and do you think they screw you?
So it depends on the Chipotle. Some Chipotles, dude, the workers don't give a fuck, and they bless you. They bless you. My go-to Chipotle order, I don't know if it's the best because everyone's
subjective.
Everyone's Chipotle orders, they all say it's the best. I'll give you my go-to. My go-to is double white rice, chicken steak double. No, I'm not a beans guy, so no beans. I mean, I'll eat them if it's in it, but like I don't prefer it. Pico, the hot salsa, cheese, light sour cream, guac, and lettuce. It's my go-to with chips on the side, so you can scoop the bowl with the chips.
Really load that thing up.
Yeah, dude. I mean, I don't get Chipotle often, so when I do it right.
Yeah, fair. Okay. Coach
All right,
Otto?
so, go ahead.
I think that, Coach, you think I am... Hey, I know what I know. All right, hold on. First of all, I know what I know. And one thing that I know is my order is not the best order, so I don't even need to speak on. The question was, what is the best Chipotle order? I do not think my order is the best. That's
What
just
do you
what I
get?
get.
What do you get?
White rice, black beans, double chicken.
That's it?
Yep.
Yeah, dude, that's rugged. You're
That's
like
all
my
I
mom.
need it for.
Dude, my
That's
mom-
all I need it for. I don't need that fluff. What am I going there? I need protein, carbs. You get some chips on the side. Maybe you roll it up in a tortilla. That's it. I don't do any of that fluff, that upcharge with the guac.
Yeah,
None of that.
Yeah,
But
my mom, dude, she does white rice, chicken, and lettuce. That's all she gets.
I don't need the fluff.
That is,
But I say I do not claim that order is the best order. For Chipotle lovers and fanatics, I fully understand that is not the best order. That's just my order.
I get
whether
the,
or not
I get
they
the rationale though.
Yeah, whether or not they screw you, now, I do have an opinion on that. I have never paid the same for my Chipotle. It's the most simple order that probably anyone goes in there and orders. I've never paid the same amount for that order.
It's never the same price.
2 times in a row. Never. Ever.
I don't go there enough to like. I haven't even had Chipotle in probably like over a month and a half. I don't even.
That's our Friday lunch. We get Chipotle every Friday for the most part, and it's pretty much the same order every single time we go. It's never the same price.
My problem with Chipotle is it's probably my own problem. Is like my bowl is like $20 something. So it's like, dude, I can't be doing that every week. Like that's it's a treat for me.
My problem with Chipotle is I'm pretty sure Chipotle is bought by McDonald's, so I do have that feeling that I'm just eating at McDonald's with other things.
Yeah. I didn't know that. That's actually kind of wild.
That was a while. I think that was a few years ago when whatever the McDonald's corporation bought them. So then there's that feeling where you get the idea, oh yeah, Chipotle is healthy. It's like, well, I mean, it's owned by the same people who own McDonald's, so like, there's got to be stuff. I'm sure it'll come out eventually of how they're doing it. But maybe
all right,
it's good.
I got a question for you guys.
Okay.
Coach didn't go though.
You got
for my Chipotle order. I agree with what you guys are saying about the price differentiators, but I go bowl, tortilla on the side, white rice, no beans, double steak, mild corn, cheese, guac. Get some chips, and we got to get a little ramekin. Fill it with that Chipotle smoked Tabasco.
Oh, dude,
pour that on your shit.
Tabasco is fire,
see,
dude.
That's the best shit right there. Yeah.
So, hey, why am I?
What's your question, Brett?
Camera.
Yeah, I know. My phone just like locked for some reason. I don't know why.
Unlock it.
That's the plan.
Good plan. There he is.
If you had to pick one fast food restaurant, fast food to me means it has to have a drive-through. What is it?
Okay.
Interesting. Has to have a drive-through.
Has to have a drive-through. I know my answer. Wendy's.
That's crazy.
And
It is crazy.
And I'm getting a 4 for $4. I'm getting chocolate frosty as the beverage, and on the side of that, I might get a Son of Baconator and spicy nugs.
Dude, I had a Baconator.
Dude, I love Wendy's.
I was hanging out with Corey up in New York, and I had a Baconator for the first time. Fire.
And it was amazing.
Yeah, it was fire.
See, Wendy's. That's my go-to fast food with a drive-through. Wendy's, 100%.
Okay.
Does Five Guys there are Five Guys locations with drive-throughs?
Nope.
I bet there are. Okay, I just starve.
You just wouldn't go.
Really?
I don't like fast food like that. I really
Dude,
am not.
I think the clear answer is Chick-fil-A.
No, Chick-fil-A has gone so downhill.
Ooh, you know
That's
what?
a crazy take. What
No,
Dave's
the
hot
you know-
chicken is better.
If
Dave's
Chick-
hot chicken is better.
Dave's Hot
Chick-fil-A,
Chicken
I
is fire,
forgot.
but
I don't go to drive-thrus that often. Chick-fil-A does have a drive-thru. Yeah, it probably would be Chick-fil-A, but like, I don't know.
It's gone downhill, I'm telling you.
Just the one
Maybe
by us.
just up
Just
here.
the one,
The one
by
up
us.
here has gone downhill. It makes you feel so shitty after. It used to not. Now you go to Dave's, you eat Dave's, it feels a little cleaner. It's a little better.
Yeah, I just don't. I'm
I
an
feel gross after
anti-fast
my
food
Chick-fil-A
guy.
just because of how much I eat. I get a
Everything.
I get it.
Everything.
get a chicken sandwich meal, a large cookies and cream milkshake, large fry, another sandwich just on the side, and then an 8-count nugget.
That sounds like Chase. That's like Chase's.
I'm doing. I mean, again, don't do that often, but when I do it right.
Yeah.
It's a treat.
I don't know. I'm an anti. I don't like fast food, but I don't like most food. I mean, food is a.
Here we go. Fuck, marry, kill.
Okay.
Back squat, power cleans, trap bar jumps. I'll go first. Okay.
Ooh.
I'm gonna marry the back squat.
Yeah.
I am going to fuck the power cleans, and we can get rid of the trap bar jumps.
I'm gonna marry the back squat. I'm gonna fuck the trap bar jump, and I'm gonna kill the power clean only because I think the trap bar jump is significantly easier to teach, and you get
Agree
similar
with
benefit.
that. I agree with that. The only reason, I guess, the reason I'm banging the power cleans is because I like breaking, and this isn't part of it. I guess it's the full clean, but I like breaking down and programming clean pull, high pull,
Yeah.
like clean shrug, and I am able to like break that piece of it down, which I like. But I guess the question was full power clean. So in that sense, I'd probably agree with you on that, Brett. But I like to break the clean down into its different implements because I do agree with you that it is way easier to teach a trap bar jump. And sometimes we only get kids for friggin' 3 weeks, and it's like, okay, now I have to teach this kid a full how to do a power clean. He does it wrong. He breaks his fucking wrist. Like,
Well, we've never had anyone break their wrist. They do.
no,
when
it's
they're-
never.
I
I've only
treated
seen it
someone
happen.
I treated a guy who broke his wrist doing a power clean. He was a thrower. He was a
Yeah.
Martino broke his wrist doing power clean at Merrimack.
yeah.
Yeah. I know a lot of athletes. I can think of 3 off the top of my head that have broken their wrist or thumb or something doing a power clean. I'd probably be the same as Brett. I'd marry the back squat. I always marry the back squat. If I could do nothing else, I would just back squat. Probably trap bar jump, just because that's what I do. I don't really do a lot of power cleans ever. Like I'm just not. I'm not a big power clean guy. I don't know. I didn't understand if the question was from like a coaching standpoint or a
Could be either.
self training standpoint.
Oh,
I
yeah,
like
guess
trap
I
bar
took it
jumps.
I took it as a coaching standpoint, not as a training.
Coaching standpoint,
I took it as
I
a
would-
training standpoint.
From
and
a
I would
coaching
do.
standpoint, I took the cleans, but not the full cleans, even though the question, I guess, was the full cleans. But I picked cleans because I like breaking it down into parts of the clean. That's why I picked that.
Yeah,
I
training.
think
I'm
that's
taking the clean.
beneficial.
Yeah, from a coaching standpoint, you'd probably want. I don't know. I like trap bar jumps. I like weighted jumps, and I like back squats. And I think if you're trying to jump higher and move faster, then keep it as simple as possible.
Yeah.
That's what I would
yeah.
go with. The simpler, the better, especially when it comes to training. If you don't need to overcomplicate something, then don't. But a lot of times guys have power cleans in their program, so they better learn how to do it so they don't break
Yeah,
their
so they don't
wrist
hurt
when they go
themselves
back
when
to
they get
school.
back to school. Yeah.
All right. I got
You have
one
another
more.
one, Brett?
Yeah. You can pick only one upper body and one lower body exercise to do for the rest of your life. Otto, you kind of already answered the lower body one. What are they?
Go ahead, Coach Otto.
Lower body, one upper body exercise,
And one lower body exercise.
push-ups.
I'm between.
Easy.
I'm between 2.
I mean, I'm obviously. Does it have to be extremely can it be extremely specific, or should it be pretty general?
You can only do it. You can only do it that one thing. So if you want to make it super specific, by all means, go for it.
Okay.
Well, I mean,
Fat-
a pull-up is a reverse push-up.
All right. Well, no, you don't get push. No, you don't get push-ups.
Inverted rows are a reverse push-up. I'll just call them. I'm doing reverse push-ups.
Okay.
I would go fat bar bench and the safety bar.
No, it has to be an exercise.
That's
Wrong.
not an exercise.
Because you can do so many lower body
the safety
exercises
bar,
with the safety bar.
is a tool. The safety bar is not an exercise.
Fuck, shit. Fuck. Fat bar bench, and yeah, it's probably honestly no, it'd be the back squat.
Yeah, I think I'm choosing front squat, and I'm between overhead press and dips, and I think I'm gonna go dips.
Interesting.
Yeah,
Okay.
I'm a big dips guy.
Coach?
I already said mine. Push-ups and squat, man. I'm on push-ups. Push-ups are king. Push-ups.
All right.
People need to do more push-ups. The amount of push-ups done by either athletes or just gen pop people is staggeringly low.
Speaking of push-ups,
Frankly-
Murph is coming up in a week.
You do it every year?
I do it every year. Yeah, I don't go for time. I just do it for fun. I train
Just do
and
it
then
to
I
do
Murph.
it. So that leads into my next question. What's next for Brett Raynor? To wrap this whole thing up. What's next? Right? He's big into jiu-jitsu. Is he going to do a tournament? Is he going to open up his own PT place up in Massachusetts?
No. No. One, no offense to you guys. Mass is too damn cold for me.
Maryland's the same. It's like the same thing.
No, it's not, dude. No, it's not.
Start with
80
M's.
87 degrees down here today. What is it up there? Fucking 70?
78.
Yeah, that's 9-degree difference, dude. Anyway, next for me, yeah, definitely I'm going to keep competing. I unfortunately missed one this last weekend. As far as from the profession is concerned, I have things in the works right now. I'm talking to my boss. My company likes to put out continuing ed courses for clinicians or really anyone. And we have an overhead athlete one, we have an ACL one, and we have a lower back one for the rotational athlete. And my boss is really, really good at treating concussions. And I want to, this is well in the future, probably a year or two in the future. Would love to collaborate with her and do some sort of like combat athlete continuing ed course, just with like her knowledge of concussions and my knowledge of jiu-jitsu, even though it's not nearly as high as some people's. I still think I have a well enough base between PT and jiu-jitsu to where like we could do something. So that I really want to get working on. Jiu-jitsu, never stopping training, so train and compete, and then just lifting heavy, training, never stopping. That's kind of it. That's all I do. I'm buying a house soon. That's cool.
And you're also getting
married. Woo.
Yeah. He's getting married soon.
This has already been an hour and 40 minutes. Actually, any other fun questions, Coach, or are we about good?
I think we're good. I think that was a great conversation,
and
we'd love to make Brett Raynor a recurring guest.
Yeah, have me back, dude. This was fun.
Strongest PT. Strongest PT in America.
America's strongest PT.
I'm pretty sure I follow a PT on Instagram. I don't remember his name, but I think he's pretty fucking strong. And if I find him again, I'll send him to you guys because he's a fucking freak.
Also, send us those continuing ed courses. We always like to.
I would love to send. I mean, I'll still send them to you. They're expensive. I get them for free because I work there. They're not cheap.
They're one of those things. Okay, well, YouTube it is.
Continuing ed courses in the medical field are never free. I get lucky because my company gives me a lump sum of money each year to do continuing ed because I have to for my job.
Gotcha.
Continuing ed is a scam.
Well, send us send us your notes then.
I'll send you all my PT school notes, dude. You can have them.
Yeah, there you go. Where can people follow along Brett Raynor and where you work and any kind of tidbits or resources for athletes and listeners to stay connected?
Yeah. So Raynor_Brett is my Instagram. Pretty straightforward. I'll probably in the near future be putting out more rehab content with different people I'm working with.
Yes.
I'm not on Twitter. I got off of that a while ago. As far as good resources, good advice that was given to me is, and it's a little more work, but I think it's beneficial in the long run, is if you're interested in something, research it and make sure that whatever you're reading, it's credible. It has, credible people that did the research, and just, read. As much as I hate doing it, it's helped me a ton. On social media, this guy will probably never see me or never know who I am, but I love his content. Coach Q Willie, he's the guy down at UNC who I mentioned earlier. He puts out tons of good content, strength and conditioning and rehab related. I steal stuff from him all the time from a rehab and just like philosophical perspective. And And then yeah, I mean, whatever you guys put out tons of good stuff too, and I follow a lot of this like same people that you guys follow, so you know.
Yeah, it was mostly a self plug, but like sure. I did say other resources,
No,
but
Brett is going to start posting more rehab stuff, and he's going to become the best physical therapist in the Northeast.
strongest PT in
Or
America.
in the East Coast.
Thank you all. Keep pushing. Don't stop. Train hard. Dream big. Get good. Yeah, pay the friggin' man. He's broke. Pay him. You need to. Yeah. All right. We're signing off.